Welcome to the Counterweight. My name is Doug Rogers. I'm joined by my co-host, Russell Stover, and we are here to talk a little bit about the news that has been in all of our echo chambers this last week. I think we've got several different things that we just wanted to opine on and kick off the week. So, Russell, why don't you just start for our audience? What are some of the big things that we want to make sure to talk about right quick today and that's top of mind for you?
Yeah, I appreciate that introduction, Doug. So for our audience that might be listening, we are recording this on January 11th at roughly 2 p.m. So it is a news
What are you
podcast,
doing on
and
a Sunday afternoon? I think is what we're asking.
right, there's probably a lot of people out there that are watching football right now or
That's
spending
right.
time with family. Uh, Doug and I are spending time with our health tech family here. There was a couple of big news drops this week, the first week of 2026. And what we heard, the first one, and I don't remember exactly what the sequencing was, but we heard from Doctronic
Yep.
that Doctronic was actually going to release what we believe to be at least the first medical prescription artificial intelligence that patients can essentially sign up, go use, and the AI will write them a prescription that they can go have filled. So that's the first piece of news. And I think we both agree that that is actually the most, maybe not the biggest headline, but the most compelling part of this. And we'll talk about that. The second part, which I think really generated the most headlines, was that OpenAI is essentially releasing two different healthcare applications. The first one is a consumer version of ChatGPT, which is called ChatGPT Health. And then the second is a product that's going to be marketed to health systems. And I think that one's called, we can go back and check this, but I think it's ChatGPT Healthcare. Is that right?
I think it's ChatGPT for health.
For health.
It's a
Okay.
very odd naming nomenclature, if you will.
Okay.
Yeah.
Interesting. So there's these two different particular products, and they have different use cases. So we'll talk about that at the top of the podcast here. We're also going to talk a little bit about JPMorgan Health Conference, which begins tomorrow. And is there anything else that I'm forgetting that we wanted to talk about today?
I think the only other thing that we'll wrap up with is and there's been a lot of talk. We actually wrote about it in our most recent Counterweight Substack article, but it's the lapse of the ACA subsidies impacting 24 million Americans and our thoughts around what that's actually going to mean for consumerism, for better or worse, and healthcare. But let's start
Thank you,
with
Doug. That kind
ChatGPT,
of
although I think that
connects.
will come full circle. Absolutely.
Yeah. Yeah. That kind of connects these topics really in an important way, which gives it context. So I'm going to start off. I've been thinking for me, and I know that you've been really focused on Doctronic, and I think it is the
Yeah,
most interesting thing that's happened. But I want to talk a little bit about ChatGPT Health because it's getting a lot of headlines.
it is.
You know, this isn't the only, this isn't so the first thing that I'll say is whenever I first looked at it to me felt a little bit like a new version of a PHR because, you or me or anybody else can go to ChatGPT right now and have a conversation about our health. And what's going to be different here is that they're going to be connecting to the national exchanges and some of the interop plumbing through, I think, Be Well Health to actually be able to process and download anybody's health records. So that's different. It takes you back to some of the things that have happened in the past with Microsoft Health Vault and Google Health, which were both, you know, essentially PHRs and attempts by, big tech to create a framework for personal health records. So this is different though. This is
It
this
is
is
different.
noticeably different, and
But
we'll have to see what the outcome
what
is.
would
But
you
yeah.
say, what is the difference between ChatGPT Health for you and I as a consumer versus what Microsoft Health Vault or the Google PHR entity was in your mind?
Well, I have to be a little bit careful because I never really did you ever use I never used
Yeah,
either of those PHRs.
I did. I did.
I did use I did use Apple and I connected my health records to Apple because um, I think it was very static, right? It wasn't gonna, in all circumstances, my understanding was it was a way for you to essentially put your record in the cloud so that you could use it and take it someplace else if you needed to. But it wasn't necessarily a way to get medical advice or get some type of advice from an AI. And that's what this is doing, which is essentially you are giving it your health information as context. It is taking that context and it is using that to interact with you.
And
And
I think
that's
that's
completely,
I think that's the big aha. And I know this feels obvious for all of our listeners because you're using these AI tools. You're probably already using, I know I do, Russell, I suspect you do. You probably already use Gemini, ChatGPT, et cetera, and ask it health related questions for you, for your family, et cetera. You weren't waiting on them to release this super duper special version. And so in my mind, the biggest difference between what OpenAI just launched versus what Microsoft or Google or et cetera had tried to do in the past around a personal health record is the difference between simply aggregation versus context. And really, it's almost as if our medical records in this case it's the icing on the cake. It gives the model more context to be more personal in what it says back when you ask it a question. But if you don't give it any of your medical records, it's still going to perform. It's still going to answer your questions. It's going to give you, even though it says it's not medical advice, it's going to tell you what a treatment protocol could be or what a diagnosis may look like. It just now has more context. Whereas these other things, they were just simply aggregation with no analysis, with no insight. It didn't really solve a need other than make you feel like you had things in one place.
yeah. Um, and to be clear, like this is new for a big major player in health
Yeah.
tech, right? Well, in technology, really. But it's not new in the sense that there have been some other smaller, in many cases, startups that have
Yeah.
launched similar applications of LLMs where you have the ability, and we may get a chance to talk to some of these folks on the podcast, but there's a company named Insightful Med, and there's another
Mhm.
organization or another company called My Doctor Friend that
Yeah.
have this ability where you can load your medical record into that platform and it will use that as context to offer you information based on that using some LLM that they have in the back end. But I think in not all of these are HIPAA covered entities. And that is a distinction that kind of stood out to me right away was the fact that, Google, Microsoft, Apple, when they attempted this, they did decide to become HIPAA covered entities. So, that comes with it some distinction of the way that the business will operate and the way that the structure of the application will be. But OpenAI has notably decided not to do that. So that's one thing that stood out to me. And another thing that I think that some people might be missing is that OpenAI committed to do this over the summer. So
Mm.
I think it was in July or August. CMS had a group of different health tech luminaries and just technology companies come to
That's
Washington,
right. Yes.
and they explicitly made a pledge to stand up these patient facing apps that would connect to the national networks. So OpenAI is delivering on that pledge. There are others who have not yet done so, but I assume that they're going to. And Anthropic was on this list along with Google, along with, I think that there was probably almost 2 dozen other ones. And this is all public facing. So maybe we'll send it out there as part of the meeting notes today. But I think that's interesting. This has been coming for a long time. And there's going to be more of it. And they'll all probably distinct themselves or, market themselves in a slightly different way.
So Russell, I've got two big questions for you from your vantage point. One, do you think that this announcement, so what OpenAI just did, I mean, let's be clear, they announced a thing that was kind of already available, but they're more specialized version. You have to join a wait list before you get access to it. But do you think this is going to be disruptive to XYZ number of companies that were building something like this on top of an OpenAI foundational model or Gemini foundational model or a Meta, et cetera?
Yeah, I think so. But I don't, let's be fair. whenever other big tech companies have attempted to do this, it hasn't, I don't know that I'd say it failed, but it didn't have staying power. And I don't know that it really got the uptick what they wanted, which was people essentially giving their medical information, putting that into these old PHRs. So I
Yeah.
think that success for this has to be judged based on whether or not they get people to send them their information. And the question is, will you, from a convenience standpoint, it's definitely going to be easier because a lot of people are already using it, right?
Yeah, that's right.
And the distinction to go to a different application is significant. But then I think the question then becomes, how do you, how do you market yourself if you're not OpenAI and you're delivering an application and it well, it'll be interesting to see how they tried to make themselves distinct um, in the what they're offering, whenever they all right now seem quite similar.
Yeah, I think that's right. And I think what I'm really watching is not just OpenAI, but yeah, I think to your earlier point, we should fully expect in the next several weeks, Google's going to announce something similar. Anthropic's probably going to announce something similar. And I'm actually really surprised that you haven't seen Meta play in this space. I mean, they're playing in the foundational model space and certainly a huge investment in AI, but you don't really see them aggressively in the healthcare space in the same way that OpenAI or to some degree Gemini has been. I do think it's going to have a freeze factor. If you're building anything that's direct to consumer and is a medical chat bot, and you can't make some differentiation on other services that you're delivering as part of that, I think it's going to freeze any type of investor that's looking at your product. The flip side of this is I don't I don't believe that OpenAI, who knows about the other firms, has any real desire to build services that are not going after 300 million, 500 million people. So they're very much in the direct to consumer space. They will make things accessible to the enterprise, but I think they want the most users, giving them the most information, and they're going to orient their time and energy to that versus building specific things that help people navigate or schedule appointments or et cetera, that require some type of enterprise partnership or engagement or purchasing, et cetera. That's my theory. I guess we'll see. So Russell, is this good? Is this a good thing for you and I as consumers?
I'm dubious.
Dubious.
I'm
Color me
very dubious.
dubious. All right.
Yeah.
Why is that?
It's interesting. So like, and I told you I have a rant. So here we go.
Yeah. Rant away.
But
Do it.
I thought it was interesting that the day before OpenAI announced this, that the FDA commissioner, Marty McRae, I hope I'm pronouncing that right. He spoke at the Consumer Electronics Show in Las Vegas, and he had basically, he had made note of the fact that the FDA is going to be a little bit more, limited in how they regulate some of these consumer-facing apps that are either coming from, wearable companies or big tech. So it kind of, it set the stage for the announcement that
Yeah.
came the next day. And in particular, we talked about the fact that ChatGPT is not HIPAA. It's not going to be HIPAA covered, but what it is a health app. And I think what that they are very intentionally trying to avoid themselves being a part of being seen as providing medical advice. But I'm not sure that the people that use it are going to feel the same way. The idea
Yeah.
is that you use this and then it takes you to a certain point and then connects you with your provider. I think, it feels to me like I'm not sitting here to tell you, like, we've just been through a lot of this over the last several years where there are a lot of influencers and people in the health and wellness community that may not have that aren't doctors. And not being a doctor, not being a medical professional, you have a lot more latitude to say whatever you want, and you're not bound by the Hippocratic Oath or any state regulating bodies whenever you come out and you provide your opinion. And I think that that's something that, we saw it during the pandemic. I think this is something that the doctors have had to deal with for at an ever increasing rate. And my concern here is that, you know, OpenAI has put themselves in a position with the way that they are framing this particular piece of technology that really gives them the ability to do whatever they want with this tool. I'm not saying that it's going to sell you snake oil, but they can. They've not put themselves in a position where they have limited their options. And for a medical provider, if I were a medical professional or a doctor, that creates a very difficult situation where you are bound by that. And this is your profession. And if somebody asks you a question, you have to deliver medical expertise. And ChatGPT doesn't. It just has to make you come back. And I think that that's, potentially problematic. I'm not going to upload my information. I'm going to wait and see where this all goes. I would love the opportunity to upload my health record into one of these tools. And I'm
Yeah.
hopeful that one will present itself that, makes that reasonable. But I'm going to hold off for now and just kind of see how this plays out.
So I'm going to play devil's advocate a little bit, but it's going to be a little hard because there's certain things that you just talked about that I agree with. So one, I am I'm excited about it. I'm bullish on the value and impact that it can have on the average consumer. I mean, we know the broad macro problem here in the US. 100 million people have little to no access to primary care. And so invariably they're turning to other resources. If that resource is much more competent and are trained on medical science than, say, your average influencer that you may follow on Instagram, that's probably a good thing. Now, the flip side, I think you're exactly right. I mean, the OpenAI and these other firms will have the same scenario. They're going to have their cake and eat it too, meaning that they can present themselves as an expert with no ramifications if they give something that's not expert advice. And how are you and I going to know? Because I mean, when I read this stuff, I was like, oh man, this feels really right. It's presented in a way that feels like it's coming off of evidence. It feels like it's coming from a doctor. So I do agree. I think there's a real danger, but I'm bullish on it. Now, I will say where I'm most bullish, and I think the challenge both to health systems, to doctors, to healthcare entities is lean into this. Don't run away from it. And the good news is I already hear doctors talk about this, that hey, they're embracing these types of technologies, et cetera, et cetera. But what I mean by lean into this, just know 240 million people today are going to ChatGPT and asking it questions. It would be better if your patients first went to ChatGPT, asked a question, and when it answered and it gave some guidance or recommendation, that it told you. And that perhaps it actually suggested that you should reach out. And that doesn't necessarily have to be that you, the doctor, type up of an email. I mean, we have got all kinds of automation tools where it could trigger a note from your care team saying, hey, I see that you're really concerned about this and you're getting some really good guidance. I'm reviewing the stuff that, this bot is telling you, but we'd be happy to talk to you about it and provide a little extra counsel or, how, what should you be considering from your treatment perspective? That's the type of proactive care I think that we all want. And I would love to see these two things get meshed together in a way that doesn't exist today, and that instead you're bringing this to your doctor and then they're reacting to it.
Yeah.
That's just
It's a
my
really
my two
exciting
cents.
opportunity. Yeah, it's a really
Yeah,
exciting opportunity. Doug, I don't think that what you've said or that many, I don't think that the excitement about this in any way, shape, or form is misplaced. I think
yeah,
that
yeah,
there's a lot of reason to be excited. And what you just described is exactly the opportunity that's in front of us. And,
yeah.
there was
So
another announcement this week. Do you want to talk about
yeah,
Doctronic?
yeah, let's do it. And hey, before we do that, just to kind of bridge the two, Byron Crow, who's the chief medical officer at Doctronic, posted today, in fact, on LinkedIn. So I'm just going to read a summation right quick. A lot of debate. This is what Byron posted. A lot of debate right now about who can be your doctor. Here's the clarification. Examples of who can be your doctor: your primary care physician, your specialist you see regularly, your local health system, One Medical, the VA, Kaiser Permanente, Doctronic, and in parentheses, he says, our nationwide clinic. Examples of who cannot be your doctor. Once again, this is Byron Crow, the Chief Medical Officer of Doctronic. Who cannot be your doctor? Anyone without a medical license. An institution without physicians. A humanoid robot in a white coat. An AI chatbot. Doctor is a role, practicing medicine is a function, AI is a tool. I thought that was pretty insightful. So let's talk about the Doctronic announcement. What did you see in the headlines this week?
So what I saw was, it was, and I don't know which came first, but I mean, the big deal here is that Doctronic is going to actually be able to write prescriptions for patients whenever they come to it for care, and it's fully automated. And I believe now, I haven't read into the structure of the company.
Yeah.
I know it's based in Utah, and I know that there's some unique, their ability to practice in all 50 states is a little bit unique because of some laws that exist, or some grayness that exists in the regulations of the states. But this is huge news. This is completely new. This is, to my knowledge, at least. Maybe there was
Yeah.
somebody out there doing this, but they certainly weren't
So no,
talking
I think
about it.
you're exactly right. But so a couple of clarifications there. So to your point, they are the very first AI company to be approved in any state. So state of Utah is the one who gave them the regulatory approval, or probably said another way, they gave them almost like a proof of concept time period, regulatory proof of concept. State of Utah gave Doctronic the ability to renew a medication without a human in the loop. And so here's what that really means is you're a patient, you get prescribed a medication, whether by one of Doctronic's physicians. So Doctronic is a company that has an AI chatbot that you interact with typically first, and then it escalates for any type of actual care diagnosis, care treatment, to typically a telehealth physician. Could be anywhere in the nation. So they have they contract with network of doctors or PAs that you then have a telehealth visit. In today's world, those telehealth visits that doctor could prescribe, assuming they have the right licensure, et cetera, they could prescribe a medication, you could go pick it up. So let's say you got a prescription, whether through a Doctronic doc or a physician in Utah, and then you go to Doctronic because your prescription's up for renewal. If it's one of the 190 that the state of Utah says, yes, we are comfortable with, then the AI can look at the renewal, look at your information, make a decision to send the renewal back to the pharmacy or not, and they do that automatically without a human touching it. Now, in reality, at least the way Doctronic has framed this, is that the state of Utah has authorized 190 different medications, more kind of general, probably lower risk medications, no controlled substances in this batch that it can renew. And Doctronic has agreed that the first 250 renewals will be reviewed by a physician. So they're not going to be a stopping point, but they will review the AI's decision making, and then you can assume after 251 that no one's looking. I mean, I'm sure they will look at it, but there's not really a review cycle. The AI is off and running and just renewing. And I think this is a huge deal. I think this is the
Yeah.
first hole in the dam, if you will, that moves us to seeing a fully licensed AI doctor in practice in the next 5 years. That's my prediction.
Yeah. Let me ask you something, Doug. So it makes sense that refills would be
Yeah,
kind of the entryway into this, right? But there's more dominoes to fall, right?
there are
As
more
you kind of
dominoes to
go up
fall.
as
Yep.
you go up the stream, or up the the proverbial pyramid of complexity. And presumably that's kind of how this will unfold, right?
Well,
As you'll
here's
kind
the
of,
here's the real question, and you referenced the FDA earlier. Is this a medical device? Is the AI a medical device? So today, I'm writing a Substack for the Counterweight to talk about this among other things. And one of the things I've been going through, Russell, the background, really two things. One, what's the journey we've been on from a medical society perspective in terms of who can actually prescribe and who regulates it? And then what's the distinction between over the counter and prescribed medication? So first of all, for a majority of our history, medications were all over the counter. It wasn't until the 90s that legislation was passed that made the distinction between prescribed medication over the counter. Then there were subsequent amendments that came out that impacted safety and then efficacy, et cetera, et cetera. So really, it wasn't until let's call it 1970 and beyond that we really got any type of meaningful regulation and a number of medications moving into where they could only be prescribed. You could not get them over the counter. Separately, on the prescribing side, this is largely a state function. It's defined at the state level. When you get certified as a provider, the licensure at the state determines who can prescribe or not. It's actually more than just a physician. And there's this, I'm still doing a little bit of research, but there's this movement called, I think, full access that's expanding the role of which providers beyond physicians can do it. There's 20 states or so who have adopted this. That includes PAs, PPs, et cetera, that can actually prescribe and are authorized renewals outside of the doctor. But it's largely a state regulation. Um, but you're tied to what at the federal level, you're tied to your NPAI number, which is produced by CMS. And then for controlled substances, it's your DEA number. Neither of those organizations are the FDA. So today, the FDA has no regulatory oversight in terms of a doctor, their ability to prescribe a medication. So the question
They just
for
have oversight
Doctronics,
over of what needs to be prescribed and what
well,
doesn't.
they have that's right. They have oversight over pharmaceutical companies. So is this a drug that needs to be prescribed or can be over the counter? When does it transition? They have oversight on medical devices, the X-ray machines, the pumps, the ventilators, et cetera. But the question for Doctronics and for every other AI company is the AI a medical device, or is the AI an entity that is operating within the bounds of licensure that's regulated at the state and or at the CMS level?
Yeah.
I don't have the answer for that. I think what I do know, if I were a founder, I would prefer it to be over here, CMS/state. And I think that's what you saw with Doctronics is they got approval from the state board to operate under their licensure and to do renewals. They don't need approval from CMS because it's only within the state of Utah, and they can march down every state, or they could go up and get CMS to approve this and have the ability, especially to have an MPI number, and do either renewals or prescriptions in all 50 states.
Yeah. So this is very interesting. The other day I was actually researching something, and I came upon that I think it was the 1951 Durham-Humphrey Amendment, which actually is what created this world of over-the-counter drugs. This distinction between over-the-counter versus prescription. I'm gonna take a sidetrack for a second. I'm gonna come back to this. Do you know who essentially separated the professions of pharmacy and physicians? So who made the
Don't.
distinction that?
I don't.
So I was looking this up the other day. It was Holy Roman Emperor Frederick II in 1240, the Edict of Salerno,
Wow.
and
Okay.
yeah. This, and I don't know if he was. I think he might have just been the king of Sicily at the time. He wasn't yet
Yeah.
the Holy Roman Emperor, but he separated apothecary and physicians, and physicians would diagnose and prescribe, and pharmacists would compound and dispense. So, anyways, I didn't mean to take you off
No,
track there, but what I'm
you're going to send me that
bringing it up
reference.
because I will. I'll send it to you. I bring it up because I'm kind of curious. What are we going to get more regulation on this? Because it does feel like a bit of a gray area. So are we going to get regulation to kind of, bridge this potential gray area? Or are we going to just kind of exist within this and create a system that kind of goes around that?
Well, I don't know the answer. Here's my theory. So one, there's already legislation at the federal level that was introduced in the House in 2025, and it got then moved off the floor to the committee. You can go listen to the jingle, how a bill becomes a law to understand kind of all the intricacies here. But there was, I believe, the legislation called Healthy Together Act of 2025. And essentially what the legislation was proposing is that it would authorize the FDA to acknowledge that an AI could prescribe medication if it met the requirements of the licensure for that role in the state, and the FDA approved it as a medical device. Once, if you kind of go back to what we were talking about earlier today, doctors have
So that
no
means it's got to be both.
obligation.
Yeah.
Yeah, that's right. Well, under that legislation, electronics is clearly going down a path in my mind where right now they are advocating on a state by state basis. I'm sure they're having discussions in DC, but they're advocating on a state by, and they don't really need, to be fair, they just need the federal government not to say no, and or for the FDA to say, hey, you're a medical device. The moment the FDA says you're a medical device, then everything's going to stop. And they're going to have to go through a different approval process. But right now, they can march from state to state. They've actually, the announcement came out this week. They've been doing this for a month. They've been doing this since December. So they already have renewals that are flowing through the system. They have proof points. They have probably had some really good stories, and they probably had some things where they stubbed their toes, but not enough that has stopped it from going. So they've got momentum. Here's the question I ask is, what the heck is Intermountain thinking? Or the University of Utah or Summit Health or any IPA or physician group that's in Utah, and they want to go use an AI tool to go automate renewals because it's a big time drain on the physician in basket. Part of my research I was doing yesterday on this. Your average physician, primary care physician with a 2,000 patient panel prescribes or renews 20,000 medications a year. And the renewals alone take up roughly about 30% of the time they spend outside of clinic hours on a daily basis for the work that they're doing, just working through their inbox. Do I renew
30%.
this? Do I renew? Yeah. So, we talk about pajama time. 30% of that pajama time is in basket time working on renewals. And so if I'm Intermountain Health, I'm like, hey, that's great that Doctronic got this, but I want to use that and overlay it on my inbox so my doc doesn't have to do renewals. Why do they get to do this and I don't get to do this? Why my vendor Epic not have the same? So that's the big question I have. Who's next? Who comes after Doctronic? They're not going to have this moat forever, I would presume, especially the state of Utah's already authorized one. And then I think with this current administration, less is more. I think that you reasonably will see whether or not they tell the FDA to go down this path, or they say, hey, FDA, this you don't have to worry about it, but it's Dr. Oz at the top of CMS. I think Dr. Oz would love to stand up in the next 2 years and say, we have empowered technology companies to deliver care in this way. And one of the most impactful things is to write and renew prescriptions, especially as it relates, and here's where I think it will happen first, in rural communities as part of the rural health transformation. Because they already have a shortage of doctors. They already have shortage of access. If I'm Doctronics, what I would be advocating is that, look, I can go roll out my app, and the farmer living in rural Missouri who doesn't have access to primary care can interact with my app, can get Tamiflu prescribed because it's talking to the app, clearly says I've been diagnosed with the flu with a home test, and then it gets shipped and it gets picked up at the Walgreens or the local pharmacy that's just right down the street. And the farmer never went to the hospital that probably just closed, maybe is about to close, didn't do a telehealth visit, didn't have to call their doctor. I mean, that's the story I'd be telling, and I think they're gonna get a lot of momentum for it.
Yeah. So this might be a good bridge to our next topic,
Yeah,
but I think you're exactly right. I think that this administration, I think they do want this to happen. And I think that they want the slack
yeah.
that's probably going to be opened up by some of the changes that we're about to talk about to be picked up by these technologies, these scalable technologies.
Yeah, that's right. That's right. So let's turn the page a little bit. Speaking of the administration, big health systems, big to-dos, if you will. There's a shindig kicking off tomorrow. The JPMorgan Healthcare Conference in San Francisco runs Monday through Thursday. I'm not going to be there, Russell. I don't think you're going to be there. But any thoughts around what we think we're going to hear coming out of this conference? Any kind of big headlines you would project?
Well, I'm hoping that we hear, we know a lot of big health systems are going to be there. So I'm hoping that we start to get some headlines in terms of their perspective on what happened in this past week. I think that if we look at this as, health systems have not traditionally done well in my opinion, in terms of serving consumers. And, they've, they may be getting outflanked here, and I'm interested to see what their response is and how they're going to take this on, because I think that there's a great opportunity for them to be involved with this because of the trust that people have in these organizations. But, they haven't done that. They just not delivered for a number of different reasons. So maybe we'll
Yeah.
hear about that. Is there anything that you're interested in hearing about?
Yeah, I mean, I'm going to be really fascinated with the big health systems, how they talk about financial performance both in 25 and then looking forward to 26. My suspicion is that what you're going to hear is that by and large, not true across all the cases, but by and large, 25 was better than expected financially, especially from a top line perspective, perhaps from a little bit from margin. I think they're all going to talk about labor costs are still eating their shorts and that labor costs are growing and they're grappling with, and they're looking to AI to help solve kind of their labor shortage slash labor cost. But what I'm really listening for and what I think we're going to hear is that they're going to say, hey, we probably did a little bit better in 25 than what we expected, but we're really concerned about 26. And the two big headwinds they're going to point to is 24 million people on January 1st well, either did not renew insurance through the ACA because they lost their subsidies, or they did renew, but the premium's going up anywhere from 1 to 4x. That is not an exaggeration, by the way. 1 to 4x. I mean, there are any number of accounts where you're seeing people whose premiums are going up from $500 a month to $2,000 a month for high deductible plan that still has a significant out of pocket, both deductible and out of pocket maximum before really any of the major coverage kicks in. So what I think you're going to hear health systems to say is that we're going to see people delaying care or who are coming in for either uncompensated or cash care. And then at the back end of 26 going into 27 is when all of the meaningful Medicaid changes start taking effect that came out of the federal legislation in 25. And so you're going to have a double whammy of 24 million people either delaying or uncompensated. You're going to have a reduction of medication rolls, which means that you're going to have less reimbursement. Even if Medicaid was paying 30 cents on dollars, 30 cents that the health system was getting that now they're not going to get. So that's my belief. That's what I'm listening for.
Yeah, and I think it's a triple whammy, honestly, and I and
Oh,
it
all right.
has to
Yeah.
do with, and I'm gonna bring up one other piece of this, which is connected, which is 340B.
Yeah.
So
So say more about that.
it's been under the surface, but 340B has been an enormous margin creation engine for a lot of these major health systems that have disproportionate share hospitals or organizations that are part of what they do. And as part of the Inflation Reduction Act, there was some provisions which are going to impact these organizations. And then as Medicaid coverage starts to compress, there's going to be fewer organizations that are even eligible to be disproportionate share organizations and that are even eligible to be a part of the 340B program. So I think, these things happening all at once is going to be very difficult for health systems to navigate.
Yeah. I had not even thought about 340B. So to your point, it's going to be really interesting to see how they talk about that. That's a really, really good call out. There was a health system. I was listening to their CEO. He was on the Heart of Healthcare pod. I know you and I both love and listen to that particular pod, but he talked about they are an essential health system, otherwise known as a safety net health system. And he talked about the impacts fiscally to their organization. He said if it were not for 340B and the wholly owned managed care plan that they have, they would not have been financially positive in the last several years. And now one of those levers is right being largely going to be taken away. Now you could argue right or wrong in terms of how 340B is set up, what it was meant to do versus how health systems use it now. But there is a reality that it is a financial lifeline for many health systems in terms of how they close the gap, especially on the margin side.
Yeah, it's part of their operational structure at this point,
Yeah,
which is it's really complicated.
it is really complicated. All right, so I think we've got just a number of thoughts here around between ChatGPT essentially launching. I mean, they're, yeah, as we said earlier, they're getting their cake and they're going to eat it too. But let's call a spade a spade. They launched an AI doctor on your phone. They may not have, they may say, hey, this is not medical advice, et cetera, but they just launched and they told 350 million Americans that you now have access to a doctor on your phone. And if you upload your medical records, for all intents and purposes, it is just as good as if you went to see the doctor. Now, that's my words. That's not their words, but I think that's what most people are going to hear. And that's what they're going to experience. We saw Doctronics be the first AI company to be able to renew medications. That's a stepping stone. It's a first step. I think they're not going to be the last one. I think you're going to see a wave of these in 26. And then we certainly talked about what we think we're going to hear from JPM, the impact of the ACA subsidies, as you called out, the changes in the 3B program, what that's going to mean for healthcare. I just would close out, Russell, and we talked about this in the Counterweight Substack that we posted at the beginning of this last week. For better or worse, this is the year of the consumer. And the consumer is going to have more access to information, whether it's whether it's what comes through ChatGPT, whether it's transparency around pricing, et cetera, than they've ever had before. But more consumers are going to have more necessity to use these things because either they have really high cost plans or they have no plans whatsoever. And so
Yeah,
invariably,
as
it's going to drive them to tools like this to figure out how to navigate out of necessity because they don't have any other choices.
yeah, as health systems and providers are in a sense forced to kind of, you know, to some extent reassess their capacity to extend care, technology is going to be asked to fill this gap. And that's, whether it be from health system technology or consumer
Yeah,
technology, this is what we're going up. This is what's happening. And it's a transformation. It's not going to be 1 year. It's going to happen over time, but this is
it
really the start of
this
it. You're exactly right.
I think we're going to look back 12 months from now, 24 months from now as this first week of 26 as the moment that the dam really started to break in terms of not just consumerism, but AI really becoming at the forefront in terms of playing the role of the doctor. So, Russell, this has been super fun. I don't know what other people do on a Sunday afternoon, but if they're not sitting around with their friends and colleagues talking about health tech, then I don't understand how they're having fun. I mean, what else would you want to do on a Sunday afternoon?
I don't know,
I don't
man.
know.
I'm going to go see my family now.
Well, that's
See if
also probably a great thing to do on a Sunday afternoon. Always good to see you. I wish you the best as we dive into the week. Thank you for going back and forth with me. This has been the Counterweight. I hope everyone takes the chance to listen. Subscribe to our YouTube channel, our LinkedIn channel, subscribe to our Substack. We've got a lot of thoughts that are coming out on this that I think you'll find value. It's good to see you. Always drop your feedback in the comments. See you around the horn.